Well, to this now, a shortage of healthcare workers is currently threatening the health system. And this is according to the South African Medical Association and the Democratic Nursing Organization of South Africa. Now, they say healthcare workers are becoming scarce, and it's a problem that the department needs to tackle quite urgently. Summer says there is currently less than one doctor per 1,000 patients. So let's get more information on this from Summer's National Finance Chairperson, Dr. Mzulungile Nodikida, joining me this morning to take this conversation further. Doc, thank you for your time and good morning to you. This is a problem. 1 to every 1,000 patients. How do we get here as a country?
All right. Thank you very much, Tumelo, and good morning to you and to your viewers. I think we need to put this into context, Tumelo. According to the WHO, which is the World Health Organization, there is a global shortage of healthcare workers. And they estimate this to increase up to about 18 million healthcare workers needed in the next 8 years. So there is a global context to it. But when you take it home to our country, South Africa, we have a different problem. One is that the private sector might be better off in terms of the availability of doctors, but in the public health system, that's where the problem we think as the South African Medical Association is at a critical stage.
Yeah. But Doc, that's my question precisely. How did the National Health Department allow this problem to escalate to this point? I mean, if the stats are saying there's one doctor in every public hospital on average to 1,000 patients, surely the department had seen by the time there was one doctor to 10 or one doctor to 100 or to even 500 that this is going to be a problem that's getting out of control. Yes, there was COVID-19 as well that escalated some of the challenges and issues within the department. But I mean, is it too late for the department to do something about it now?
So no, it's not. In fact, they've done well if you look at the fact that they've trained quite a number of doctors. So South Africa, I think under Minister Mzulungile, they saw this around 2012, and they increased the number of doctors that they were training in Cuba who would come in and join South Africa. And you would have seen that we received quite a number of them coming back into the country. But from Sama's point of view, we think the problem is more in the planning. And we don't think that the planning was done very well because these doctors came back and the Eastern Cape and the Limpopo province were the first to release those bursary holders to say that they cannot appoint them because of lack of funding.
Yeah. And
so about 121 of them were released and 91 of them were doctors.
I want to talk about that planning once more and just dwell on it just for a sec, Doc, if you may allow me. I mean, are you also referring to the placement of doctors as well? If the information we have is anything to go by, it seems that interns, community service doctors, also just in terms of placing, that system hasn't been as efficient as it needs to be. We've continuously had conversations as well about nurses as well, who haven't been placed, who are qualified, ready to take on the role in public hospitals, but there seems to be a system breakdown in their placement.
Again, it boils down to planning. South Africa knows that they've got how many doctors, student doctors who are in their final year in medical school as we speak. We know that information. South Africa also know how many doctors who are currently doing internship today. We know that information. We have it. So why do we wait until towards the end of the year for us to process their placement? We are supposed to be placing them at the beginning of this year, preparing for the next year. We know how many students or final year students, we know how many of them are in Cuba. Even those who are in Cuba, in fact, they come and finish here in South Africa. So we know them because they are part of the cohort of the final year students in South African universities today. So we as the South African Medical Association have been having a serious problem with the placement of both interns and community service. And the community service aspect of this placement, Tumel, is the most important one, especially for the rural and the poor people in our country, because that's a system that...
I seem to have lost Dr. Mzulungile Nodikida there, about to make such an important point. SAMA's National Finance Chairperson, but obviously reiterating how rural areas are where, of course, this problem is most felt. The urgency for the Department of Health to deal with the scarcity of doctors, of course, is what the association is reiterating. And I've just seen here a survey that the association also refers to, saying that 40% of doctors as well wanting to immigrate. And Doc, I mean, I understand that you're back. My team telling me that you're back with me. You will still continue with your point about rural areas being particularly where this issue needs to be resolved. But also, while you're still trying to address this matter with the department, I was just referring to our viewers that, again, the survey telling us that 40% of doctors considering immigrating.
Yes. So this is another huge problem, Tumelo. And what contributes to that is the poor working conditions at these hospitals. Doctors sometimes feel that they don't have enough equipment and machinery to work and do what they were trained to do. Also, the issue around safety it came out strongly in the survey that doctors were not feeling safe in these areas where they work. Now that then triggers all of these things. If you combine all of that with the fact that in the public health system, you also have what we call committed overtime, which means that you are expected to work over and above what you are supposed to work. So that takes a toll on your physical and your mental health.
All right, Doc, we have to leave it there due to time, but I appreciate you speaking to us this morning. Dr. Mzulungile Nodikida, SAMA's National Finance Chairperson, of course, making that plea for the National Health Department to ensure that they address the scarcity of doctors in public hospitals quite urgently.